Hello everyone, my name is Dr. Ashok Gupta and I'm coming up with this video with a new question and its rationalization. This question is towards investigations and their role in different disorders, as well as there is a new trick I'm going to teach you in this question, that is when there are two answers and both of them are right and the two answers which are not right, so how to come on conclusion out of these two right answers, which one is the best answer, and I need to pick one. Okay, so I request you to pause the video for 1 minute, read the question, rationalize it and reach to a right answer, then we'll solve it. Okay, according to the question, is a young boy with a disorder which is provisionally diagnosed as osteogenesis imperfecta. Okay. If you remember my previous video, you know about how exactly you define and the symptoms of osteogenesis imperfecta. But this question is not exactly about that. This question is about the lab investigations done into the similar condition. You have 4 options into this. One option is X-ray and a bone scan. Second option is MRI. Third option is a CT scan and X-ray. And then fourth option is X-ray, bone scan and serological testing. Okay, let's start with the let's start with the second one, which is MRI. Very easy to exclude this with. Reason is MRI is done to investigate on the soft tissues. It's less useful in the bone structures, so take it off. Okay, now we have the first, third and the fourth option. Okay, third option, if you remember, X-ray. And when X-ray is done on multiple levels, that's called as a CT. So X-ray and CT is a similar investigations. If generally they are not done in a combination. Once if X-ray is negative, generally we go on to some other kind of investigation, or we directly investigate via CT scan. So this option or this combination is hardly seen. I'm not saying it's wrong, but it's a hardly seen option. So let's keep it down and then talk about the first and the fourth option. If you see it properly, the first option gives you X-ray and a bone scan, and the last option gives you X-ray, bone scan and serological testing. Means the first answer is embedded into the third answer. Means the serological testing has a main role to find out which one of these is a right answer. If serological testing is a good indicator, we will go with the fourth. If the serological is the bad indicator, we'll go with the first one. Okay, let me tell you, X-ray is an investigation which talk about the bony deformities. It just picks up the fractures or the stress fractures are very minimally seen, but any kind of a bony deformities is seen on X-ray. It's a preliminary investigation usually done. Bone scan, it's a very good investigation done in a part of whenever there's an inflammation or the fractures or stress fractures is very commonly diagnosed with the bone scans, and it's a good investigation done whenever there is a disorder related to the bone. So the third one, serological testing. According to the latest researches as well as in this literature, it has been well mentioned that serological testings are positive with a microRNA, which is a biological indicator of osteogenesis imperfecta, and which gives a straight indication now that the option 3 is a better answer than the option 1, as X-ray is a good indication, bone scan is a good indication, and serological testing is also one of important investigation done in osteogenesis imperfecta. So I'll better choose in the last option, which is answer D. Take care.